All right, so like I was saying, we are a full service medical spa. I'll go into briefly kind of the services that we offer. And if you have, I'll show some before and afters as well as like what some of the downtime is for some of these treatments, because that's what a lot of people want to know. And then just kind of, if you have questions, you can find me after and we can, I can directly talk to you about kind of what your concern is. But we offer medical grade aesthetic treatments, which is that are going to deliver real results. So we do not have, we're not into gimmicky type machines or anything. We want to all our patients to reach their goal, that we have an initial consultation. We go over a full treatment plan, depending on how long that will take. And then that patient will continue to come and we'll finish out the customized treatment plan for that person's goal. And again, everyone that is going to be working with you and looking at your skin is highly trained, board certified PA, which is myself, or a board certified RN as well. So some of our most popular type treatments would be our injectables. So you have your wrinkle relaxers, if you've ever heard of BOTOX, Dysport. The newest one we have now is Daxxify, which we're one of the first practices in Connecticut to kind of roll out and use Daxxify on our patients, which is pretty exciting. We offer dermal fillers, so I'm sure you've heard of filler before. Most often it's put in the cheek, the lips. It's there to reestablish the volume loss that we have with aging. And then we also have Sculptra, which is a biostimulating type injectable, which is kind of, it just stimulates your own body's natural volume and collagen production and gives a nice, beautiful glow to the skin. Then we have our laser clinic, which is also a big part of our practice. Some of those include broadband light, or BBL. We have our Halo fractionated laser, Moxie fractionated laser, our full field resurfacing laser, laser vein treatments, laser hair removal, and a non-invasive type skin tightening treatment called Skin Tight. And so this seems like a lot of options, but that's where the consultation comes in. We pick, kind of customize what treatments, because we oftentimes will pair a lot of these lasers together. Other things that we offer, apart from the laser and injectables, we have collagen stimulating treatments like microneedling. Another one is AquaGold, which is just a more superficial version of that. Various chemical peels. We have non-invasive body contouring with cool sculpting, microdermabrasion, medical grade facials. We have a hydrofacial device. And we also do hair restoration with PRP, which is platelet-rich plasma, or exosomes. And I'll show some before and afters on that as well. Which is for men and for women. So if you're noticing, some loss of hair or you're thinning of hair, we have some options for that. And then we also have a full line of medical grade skincare products that Dr. Collins has specifically formulated with a chemist and to kind of customize these treatment regimens to offer real results. The difference between a medical grade kind of skincare line and ones that you would find at Sephora or, the drugstore, medical grade is going to have a higher concentration of those active ingredients and in a formulation that is designed and clinically proven to offer what it's claiming to do. So that's just kind of like an overview. A little bit more about our lasers, because this is probably one of our most popular treatments that we offer. We have broadband light, or BBL, which we refer to sometimes as a photofacial. It's basically using broadband light to improve redness, broken capillaries, brown pigment. There's really little to no downtime. So we patients like love that treatment, and it just really improves the tone of the skin. Then we have things for more textural concerns, like your deeper lines and wrinkles, pore size, and some hyperpigmentation, crepey skin. Oftentimes patients complain about crepey skin or aging under the eye area. So we have a couple different options for that. The halo does a little bit more corrective work. So depending on what we're treating, so deeper and moderate to more severe textural concerns like acne scarring, like deeper lines, then we'll do something more along the halo. And then more of like a polishing to the skin, mild to moderate textural concerns, and great for hyperpigmentation is our Moxie. And that one is like very little downtime. And I'll show pictures of the downtime on these and kind of what the result is as well, so you get a picture of it. So this is a before and after here that we did a halo. We did it with a broadband light treatment. Actually, we did a series of broadband light treatments. And the plan usually, it just depends on the patient and kind of where we're starting and what the goal is. But you can see here that she had great textural improvement under the eye area, around the mouth, perioral rejuvenation, and hyperpigmentation. And just her skin overall radiance is just a lot better. So she's over the moon about that result. And then she was so happy that she wanted to maintain, so she's continuing to do maintenance broadband light treatments along with a medical grade skincare regimen. She originally came in saying, you know, I don't want to do surgery. It's just not what I want to feel better about my skin, but I'm not ready for that type of next step. So, and she didn't want to do injectables, so we offered her some laser options, and it dramatically improved her skin. There's another just view, but you can see just like the textural improvement around the mouth. And this took a combination. We stacked a couple different laser treatments together to kind of really get her. This is also from this picture where you put your face into this machine. It's called our Visia machine, and it basically creates like a very close-up picture, reproducible lighting. So there's no tricks here with the lighting. This is like a real result. There's another one where you can see it's just overall texturally, all the brown pigments, old sun damage is just dramatically different. Here's a younger patient. So we see patients for laser at all ages, and a lot of times patients that are a little bit younger want to do more of like a prejuvenation or just preventative, and then clean up some of the older sun damage. So this patient here, she just wanted to clean up some of the hyperpigmentation, and her complaint was the crepiness around the under eye area, which is one of the first places people notice aging. There's just another view. And so you can see that this is after one halo and BBL treatment, that she got that result, and she's continuing to do broadband light treatments. Next slide, I believe, is the healing diary. So this is what she went through. And she was kind enough to share these photos because most people would never show this. So as you can see, it just kind of progresses. And this is a totally normal healing process after a halo BBL, like in the settings that we did and what we had the appropriate treatment to get her to her goal. So swelling, redness, you can see there's little bronze dots on the skin. It feels like sandpaper. Swelling kind of continued for a few days. And then by day 4, it dramatically decreases, and you can, go out and not feel like, your skin looks like it's still healing, but it's not like day 1. And so she went through all of this. You can move to the next slide. And then I think it's a testament that you would go through that type of downtime and then text me to say that she's tried so many other things at different med spas, and she finally did this treatment, and she's like, sign me up next year. I'm going to do it again. She said it's the best thing I've done for my skin and worth every penny. So I think that kind of says it all. So she's like a believer in it, even after that type of downtime. Here's another one. She might look a little familiar. That's Dr. Collins. This is after one Moxie BBL. And so it just kind of polishes the skin, works on melasma and hyperpigmentation. And so the overall skin just looks brighter. The complexion looks more even. So that's with the Moxie. That's that lighter version of that halo laser. Great for prejuvenation and just kind of giving you that Instagram filter or that filtered effect to the skin. Great for pores as well. There's just another, you can kind of see how it really cleared up a lot of the pigmentation there. There's me. So I had a Moxie BBL on not even a week ago, and skin definitely see a huge improvement in some of the old sun damage that I had. And then I'll show what my healing time looked like with Moxie. So this is immediately after, so you're like, I got pretty red. I just get red in general. But you can see kind of like the demarcation line of where we treated the neck as well. Don't neglect the neck. You definitely want to treat the neck as well. And then that's just 12 hours after. So I could do this and go to work the next day and nobody would really, blink an eye. And then that's just kind of the general progression. So that's, in terms of the Moxie, it's not quite as aggressive, I would say, as the Halo. However, it's something that you can integrate into your life really easily and do a series of them, and eventually that cumulative result, you'll see a lot of improvements in the skin. There's just another, this is just after broadband light treatments alone without the Moxie or Halo laser. So overall skin, even the texture of her skin looks better. It's just more radiant. I think we did a little Botox as well, but we did some skin tight as well on the cheek area to help kind of with the starts of some jowling. There's another one. This one was after a Halo and BBL. So BBL is great for people that have rosacea or just, they're always red. You feel like your cheeks are always red or you have a lot of broken capillaries. So she saw a huge improvement in the texture of the skin as well as the tone. So it just looks brighter. Here's another one. This is kind of what BBLs can do for the skin as well. So her main concern was the hyperpigmentation here. And with a series of those broadband light treatments, she got to much brighter skin and cleared up a lot of the old sun damage. So that's kind of the laser stuff. We have a lot of options, and it really does take a consultation to kind of customize and come up with a game plan of how we're gonna get a patient to their goal. Then we have the injectable side of the practice, which is our other most common, most popular treatments as well. So I'm sure most of you know about BOTOX Dysport. Just kind of relaxes out those dynamic lines, though the scowl lines, the crow's feet. We can use it in the lower face a little bit, but it is usually a quarterly type treatment, so you want to do that every 3 to 4 months or so, and it just can dramatically increase or improve the quality of the skin. Then you have the fillers, which you have cheeks is a lot of times what patients will, we start to lose a little volume in the cheeks here. And then, yeah, we'll back up a couple. So there's various things we can do. There's a lot of things contributing to the aging process that we can tackle with injectables and make it look natural. I think the biggest thing for patients is when they say, I just don't want to look like I've had work done. And it shouldn't look like that. And we're just replacing and plumping up in areas where we've had that volume loss. And we know the line when we need to maybe pivot and maybe think about our surgical options and know when to say, okay, I think like we've done what we can with the injectables. So I like to reassure patients because we don't want to make people look unnatural either, trust me. So, but when it's done right, you can really do a lot of balancing in the face and just give a more rested, youthful look. So this patient, we did a little jawline and cheeks here, and so she just wanted a more defined jawline, and this is just done with, this is just a filler. So she had no like chin implant is a lot of times what patients will, if they were to go do a surgical, and it even improves like her neck and profile.
That's just fillers?
Mm-hmm. Yeah. Yeah, it just, this is also filler. She obviously is gorgeous to begin with, but she just wanted to balance out her face a little bit. She felt like she wanted a little more defined jawline, so that's just with filler. And then I think we did a neuromodulator Dysport on her as well, and so overall, she just feels much more confident with her profile and jawline. And there's just the side view, and that's just with filler. Everyone likes a little lip filler, so the lip filler, you know, we can keep that looking natural as well. This is a beautiful, we can correct some asymmetries, do a little perioral rejuvenation with some fillers. So this is before and immediately after. And I'll show you a couple more. This is another before and after. That's on a more mature lip, because sometimes I feel like a lot of before and afters, you just see them on like beautiful lips to start with. But we can do it on a more mature lip in a tasteful way and make it look very natural. There's another one. That's just that's not even one syringe of filler, and just kind of corrected a little asymmetry, and it almost looks like internal lip gloss in a way, or like you always have your lips kind of hydrated. And that's a healing diary on lip filler, because a lot of patients will ask about that as well. It oftentimes bruises, but you can see after just a couple days, the bruising went down, and she's well recovered. There's just a little perioral rejuvenation. We oftentimes we like to start with laser, and then if we need to do a little combination therapy with filler, so that's kind of where we see where we're starting at, and we can decide what the best route is. But this is just filler, and so you know, the plan hopefully will consist of a little bit more laser to kind of resurface and continue to improve that area. But for just one sitting of filler, and that immediate type result is great. This is a little tear trough, full facial balancing. She got cheeks, a little lip. So you can tell she just looks more rested, but it doesn't look unnatural. Like you would never know she had anything done. But that's kind of what a good facial balancing assessment and application of fillers can be really helpful. Here's just a little BOTOX, so when people feel like they look angry all the time, it just relaxes that muscle out so we're not scowling. Same thing with the forehead lines. A lot of times patients will want the crow's feet done as well. So that's just a visual for you guys of kind of what that looks like. We do it on men as well. We have BOTOX. So, you know, it's not just for the ladies. And so he really enjoyed his result too. It just really smooth. He loves the laser treatments as well. And everything looks, no one would ever know he had anything done. He just looks younger, honestly. So this is a little bit about the PRP hair restoration. So PRP is platelet-rich plasma. It's basically, we just take your own blood, so it's all your own platelets. We process them and then inject it where we want to have a little rejuvenation. It's full of growth factors, and it stimulates the hair growth in areas where we're starting to get a little thinning. It's for men and for women, but this is after, usually need a series of them, but this is after this patient started to, you know, he had always had thick hair and started to notice some thinning. And just after, you know, 3 non-invasive treatments, there's no downtime to it. That's notable improvements. I think there's just a couple more. And so it's a nice, yeah, so then these are all after a series of a couple PRP treatments. And And so for the patient that doesn't want to jump right into like hair transplant or something like that, it's a great place to start. It depends on where we're starting and the type of hair loss, and then we oftentimes will prescribe like a regimen as well, with like supplements or some topicals to help with hair loss. And that's just another one there. So those are just a little bit, I mean, we have so much more than just those pictures, but that can kind of show you that these are real results with our real patients. And so I just wanted to touch too on our memberships. I think there's a couple posters around, but this is kind of a new membership system that we're going to do. It's kind of like a subscription service, so I'm sure you guys have subscription services. With everything now is a subscription service, but there's different tiers, and so there's silver, gold, and diamond, and with each tier you're offered different perks essentially. And so a free Visia analysis, that's where we use that device to really analyze your skin. It gives you a score. We oftentimes will repeat it after, in between treatments and after your treatments. We do a skincare analysis. We prescribe your full skincare regimen. There's a birthday special, which everyone's birthday you get a special gift, a product basket. So whatever skincare regimen we prescribe, you get that regimen to start out with. And then no consultation fees. So if you want to say you wanted to do hair restoration or start, with something, and then move on to something completely different like laser hair removal or something completely different, you wouldn't have to pay for a consultation fee. And then as we bump up in the memberships, there's tiered exclusive events. So you would get invited to those, addition to the model list, which everyone wants to be a model. So if we're ever needing any models to kind of use new products on, those patients would get added to the list. And then so then with the diamond level, you get a free trial treatment. So any one of our med spa offerings, whether that be laser or just microneedling or something else, or a hydrofacial, you can choose whatever you want to do, and you get to do that treatment included. And then we also have a couple event exclusive offers. So discounting our BOTOX and Dysport, which everyone likes that. Fillers, we're doing a little bit of a discount on per syringe, and then 15% off skincare, and then 20% off laser procedures, and 10% off IV fluid therapy. So I just wanted to touch base on everything. I'm sure you guys have some questions, so you can just find me or one of the staff, and we can kind of talk about if you're interested in any of the treatments or the memberships, or just want to kind of talk about skincare. Just come by me. But thank you guys for listening, and we're really happy you're here. So enjoy.
Okay, we're really happy you're here.